The next speaker is Vern Edwards, who is the co-chair of the Southern Georgian Bay Health Coalition. Could you please welcome Vern? And you have 10 minutes.
Time up. Okay, my talk is going to be a little broader than just what happened in our particular community in Midland, Penetanguishene area, because there's a trend that's been happening across this province, and so I wanted to get at that because it also happened in our community. But I think I'll start by pointing out, when you have your doctor, one of the roles of your doctor is that they are an advocate for their patients. And we had the example here earlier today with, I believe it was Dr. Dawes, who talked about the administration wanted to kick somebody out of the hospital, and he became the advocate to say, no, that can't happen, it's going to be detrimental to their health. And just as doctors are advocates for their patients, so too our hospitals are supposed to be advocates for the health care in our community, just like municipal councils are advocates for municipal services in our communities. And what we've been seeing when that is happening is that the government has been taking a number of actions to silence dissent. And that's really what it's about. And we started to see examples. Alliston, for instance, just north of here, they had some issues there with the hospital. They were going to close the birthing unit at the hospital, and so there was opposition to the cuts in services. And the community rose up. The hospital board resigned. The government appointed a supervisor to take over the hospital, who then went in and rewrote the bylaws and eliminated the membership voting rights for that particular hospital, eliminating their democracy. And in Scarborough, again the same thing. They were looking to they have a number of satellite facilities in Scarborough. They were going to close some of those and have some cuts. There was a community uprising. There was a court challenge, which the community won. Government's response was to go in and eradicate all the members' voting rights for that particular hospital. And in Midland, a little bit different. There's two hospitals. One was French Catholic, the other one English secular hospital. There was a decision to merge the two hospitals and make them one Catholic entity. And so there was an uprising in Midland over this, and some of the board members resigned as a result. It was basically a recommendation because it's a democratic process. It's a recommendation that has to come to the membership, and they would get the vote on it. And the community, had a campaign to get more community members to sign up, and they were going to vote no. You were not going to merge the two hospitals, make it Catholic, and eliminate reproductive health services for the entire area. And so a number of board members resigned over that, and over the battle that ensued, which our coalition, Dev Mink is our co-chair over there, we were very involved in that. There was a citizens group that formed, and they were very involved. And all the controversy drove the remaining board members to resign because the citizens group were going to force an early meeting and vote this recommendation down. The government appointed a supervisor. Supervisor comes in, says, we're not going to rewrite the bylaws. That's not my role. I'm just here to sort this out, get a new board in place, etc., etc. Lo and behold, he makes his announcement, and he is rewriting the bylaws and eliminating our democratic governance at our hospital. And so they're going to merge the two hospitals. It's going to be secular. But in order to keep the Catholic Health Corporation involved in healthcare, they were handing over the last remaining provincial psychiatric hospital to them to govern. So in Kingston, again, we had the example. So one of the sisters got up earlier and talked about the CEO there being an advocate to protect healthcare in that institution. I don't think they had the same sort of democratic process in place, but again, they were an advocate. They spoke up. The government's response was put in a supervisor, fire the CEO, let's replace I think it was just the chair of the board they replaced, but all about silencing dissent. Lake of the Woods, we heard about that, where again they're saying we're not going to cut services. Our community needs these services. If you're not going to give us the money, you decide. And now they're threatening to eliminate their democratic governance up there. One of the last remaining hospitals where they actually are still on the municipal ballot, which was something that was fairly common in the past, that you were on there like school boards, and so your hospital board would get elected. Many of them later became sort of a corporate entity, and under the Corporations Act, where they have memberships. They then had AGMs and had their elections of the board of directors that way. And so we've seen a number of boards have lost their democratic governance through the Harris government, where they were merging institutions and rewriting the bylaws and taking away their democratic governance. And now, with the Liberal government, they're doing something very similar. And any time there's any sort of dissent in a community, they're going in there and using that as an excuse to rewrite the bylaws and eliminate democratic governance. I think it was Women's College Hospital. They actually went in there and said that this hospital is too complex. You shouldn't have a democratic governance. You should vote to eliminate that and just go with self-appointing boards. And they actually got a majority to do that. And so they lost the democratic governance there. The strategy or the arguments have been is that hospitals are too large and complex, and the democratic model doesn't suit them. And I'm having visions of the supervisor coming into our community and saying that in our community meeting. And I get up and I said, as I'm about to say now, the province of Ontario is a large and complex organization, and nobody in this room is going to agree to eliminate our democratic governance on that basis.
I think it's been eliminated.
And got a similar response there, and the supervisors basically said, we'll just have to agree to disagree. And proceeded to put in place a committee that would select the new board, which would then be self-appointing thereafter, suggesting that if there are concerns and the board is not addressing community issues, you can take that to the minister and the minister can intervene. Well, we've heard from the Niagara Health System what happens there, where you have a board that is not being responsive to the community needs. It's looking at closing down emergency wards down there. They're not being responsive. The doctors have voted non-confidence in the organization. And when the community takes it to the government thinks they're doing just fine, thank you very much. And so we're losing our democracy. And every time the government steps in and takes away the democratic governance of our hospital, we lose a little piece of our democracy. And people, in 2 world wars and the Korean conflict, they gave their lives to protect democracy. And here we've got a government that's taken it away from us a little bit at a time. And I think we can give up. I'm not asking you to give up your lives, but we can give up our time to fight this and protect the democratic governance of our healthcare system here in Ontario. Thank you.